Hi, my name is Dr. Babak Edraki. I am a gynecologic oncologist and I practice in Walnut Creek. I started my journey by going to UC Davis for undergraduate studies and then to George Washington University in Washington, D.C. for my medical school. After that, I did an internship at Santa Clara Valley Medical Center and then did my residency at Stanford University Medical Center. After completing my residency, I did a fellowship at Yale University in Connecticut. I am currently the Director of Gynecologic Oncology and Women's Cancer Services at John Muir Walnut Creek. I am very happy to be here to present uh, information about gynecological cancers. September is the Gynecologic Cancer Awareness Month, and there was a study that was done about a year or so ago that showed that 76% of the patients didn't know about the 5 different types of gynecologic cancers, and 86% of them didn't know what symptoms to look for if they were faced with it. I'm going to go ahead and talk about the most common gynecologic cancer, and that is endometrial or uterine cancer. Uterine cancer is a disease of mostly the postmenopausal women, and unfortunately, both the incidence and the mortality of endometrial cancer is rising in the United States and in Western countries. A lot of that has to do with some of these risk factors that we're going to be talking about as well. The risk factors include obesity, which, of course, as you know, is on the rise, diabetes, which people who are overweight tend to get diabetes as well. High blood pressure, so again, this all goes together with lifestyle changes. Obesity and diabetes kind of promote hypertension. And family history, to a certain extent, has some impact on the risk as well. There is the exogenous use of estrogen, which increases the risk of uterine cancer quite significantly also. There are really 2 different subtypes of uterine cancer. There is the what we call endometrial cancer, which is the cancers that arise from the lining of the inside of the uterus. And then there are the mesenchymal cancers, which are from the muscle of the uterus. And then there's a smattering of other very rare types of cancers from blood vessels and things of that sort inside the uterus that are extremely rare. But we'll focus on the endometrial cancer. That's the generic uterine cancer that everybody talks about. For the most part, these are curable, and the treatment is both surgery and occasionally radiation and or chemotherapy. Surgery alone in about 2/3 of the cases is curative, and in 1/3 the patients will need additional treatment either in the form of radiation therapy or chemotherapy. It's very important to know the symptoms of endometrial cancer, and it's very simple. It's postmenopausal bleeding. That's the #1 symptom of endometrial cancer. So if a woman has gone already through menopause and is having some spotting or bleeding, just even the slightest spotting is considered abnormal, they need to be evaluated. The evaluation is fairly simple. Please go to your gynecologist and they can do usually an ultrasound and a lot of times an endometrial biopsy. I have to say though that don't feel that if you have postmenopausal bleeding that you have cancer. That is not at all what I'm saying, but it is indicative of the possibility of having cancer. And so according to studies, anywhere between 11 to 20% of patients who have postmenopausal bleeding have it because of endometrial cancer. So please get it checked out, and the evaluation, again, as I said, is fairly simple. Ultrasound and an endometrial biopsy is sufficient.